I'm here again this week with Bonnie Specker, epidemiologist from South Dakota State University, she's going to give us an epidemiology 101 lesson today on the time course of COVID-19. And later in the video, she is going to talk about what's been going on with COVID-19 in our area, in the state, nationally, and in the world. Bonnie, what do you have for us for Epi 101 today?
Well, I thought it would be a good topic to go over as far as the incubation period and the infectious period, and what exactly those mean and how that fits in with the time course of COVID. The incubation period is the time between when someone is infected and when symptoms actually occur. Whereas the infectious period is the time during which a person can infect others and spread the disease. And it's also important to realize that asymptomatic individuals who have COVID can be just as infectious as symptomatic individuals. And I have included there at the bottom of this slide a reference about a study that has done, a really nice study that has shown that that's true, that the virus can be spread just as easily from someone that's asymptomatic as symptomatic. But the timeline we have, if you have day 0 here being when you're infected, the possible range in incubation period is anywhere from 2 to 14 days. So if I'm around someone who has COVID and I get it, I will start showing symptoms somewhere between 2 and 14 days. The usual incubation period for COVID is around 5 to 6 days. It'll be up to 2 weeks before I show symptoms. And then I could have symptoms or I might not. Most people, might show some sort of symptoms. And those symptoms may last 10 or more days. The infectious period starts 2 days before the symptoms appear to 10 days after the symptoms appear. So it's about a 12-day period. And the 2 days before symptoms appear is actually pretty high infectious period. So someone could not have any symptoms at all and be exposing people without them knowing it, which is also the reason why it's so important to wear masks. Once symptoms appear, you can have mild symptoms that may increase in severity between 1 and 10 days. And if it's mild case of COVID, you'll start feeling better after about 10 days. And that'll take about 10 to 14 days till you're better. But 40% of the patients are going to have shortness of breath between 7 and 15 days of having COVID. In 14% of the cases, it will end up a severe illness, and 5% will be critically ill. And those are of the symptomatic people, and that's typically happens 10 to 15 days. So there's, pretty good delay of when you get pretty sick. And this is the time when someone would be hospitalized, likely to be hospitalized would be in this group here. The ICU admissions, that occurs in 26 to 32% of the people who are hospitalized. And it typically happens 10 to 18 days after the first symptoms appear. Death is even further out, happening between, on average, 17 and 26 days from when symptoms first started appearing. So you can see it's a fairly long course of illness here. So if you think about it, the first symptoms are appearing here. The majority of the people do recover. 1 to 2 weeks later, you usually see an increase in hospitalizations, or this is when the people will be hospitalized. And then 1 to 2 weeks after hospitalization, if death occurs, that's typically when it would occur. Now, age and comorbidities are important factors in determining outcomes, but not all hospitalizations and death are limited to older people or people with comorbidities. And here's just an example based on the South Dakota data. Here we have the cases over time, and this red box is a period of time when we had quite a few cases increasing. And this, if you think about who's at risk of later hospitalization, you could say, well, it's the older people. So you could limit this cases to just those that are over 60. And that would look like this. And at the same time period, when we started seeing that increase in the South Dakota cases, you're also seeing a fairly good increase in the number of people 60 years of age or older. And then if you take that out a week or two, you're expecting that to be when you get an increase in hospitalizations. And sure enough, during that period, we're seeing quite a large increase in hospitalizations. And then after that, the 1 to 2 weeks after that, you would expect to see an increase in deaths. And we have not gotten there yet. So I would predict that the number of deaths are going to increase quite a bit between now and the middle of October based on that previous peak. But there's a few important things to remember about where these data are coming from. The data in the daily report in this weekly summary are the state data from the Department of Health dashboard. And it's really hard to pin down when symptoms actually started based on the new cases posted on the dashboard. Those cases that appear on the dashboard are ones with results reported to the Department of Health before 1 p.m. the previous day, and not the day the symptoms started. And the results are obtained anywhere from 1 to sometimes more than 7 days after someone has had a sample taken. So in a way, it's hard to do those previous projections that I just did because there's so much variability when this data is actually posted to the dashboard. Probably the most valid or closest to real-time data is the data on hospital admissions. Deaths are also a little off because what's reported on the dashboard is when a certified death record is actually filed with the state. And by law, that has to be within 5 days of the date of death. So when you see a death appearing on the dashboard, it really happened at 5 days earlier or less. So there's that variability, which makes it hard to predict. That's the little mini lesson, and hope it helps people get an idea of the time course of COVID and some of the issues with trying to use the data from the dashboard to project out what's going to happen.